More than 150 people use this food bank in Aberdeen every week. As the cost of living bites and stocks dwindle, staff say they've noticed a marked deterioration in the health of those they're seeing coming through the doors.
There's a palpable apathy amongst those that come to see us. If there's any prolonged difficulties with mental health, emotional stress, then that will come out in physical forms later on, whether it's whatever, whether it's illness, whether it's self-inflicted, whatever. I don't think there's any doubt that it's linked with austerity. We're just kind of used to this is the way it is.
Last week, these shelves were almost completely empty, forcing the food bank here to put out an appeal. Now, a new report published today has found that austerity measures introduced over the last decade has led to life expectancy stalling, and it's the poorest that are the hardest hit. Glasgow University researchers looked at UK government cuts in the years after the 2008 financial crash. They found the policies played a substantial role in the levelling of life expectancy and had affected death rates in the poorest areas.
Those continuous improvements in life expectancy that we used to see stopped around 2012, and since then life expectancy just simply hasn't improved at all. But that average trend hides the fact that life expectancy for the poorest 30 or 40% of areas has actually got worse over the last decade, and that predates the pandemic, and it's quite clear that that's linked to economic policy decisions.
Staff and customers at this social supermarket in Forfar, which sells cut-price produce, said today they weren't surprised by the report's findings.
People always thought that was the case, and now we've got a report telling us that it is the case, and for us that is a huge concern.
I think it's sad that people die in young age, like so mums and dads leaving their children as well, because they're feeding their children but they're not feeding themselves.
One GP who works with patients in some of Scotland's most severely deprived areas says a multi-agency approach is needed.
It's about access to healthcare, it's about access to services, it's about all those broader social supports that enable a person to thrive in their lives. And that's the bit that's being sort of taken away from many, many people at the moment.
The report makes a total of 40 recommendations. They include increasing benefits in line with inflation, improving social housing, and avoiding austerity measures which limit public spending. The UK government says a new health levy will raise around £12 billion, with just over £1 billion going to support the Scottish Government to further invest in health services. It adds that tackling health disparities remains a priority. Louise Hosie, STV News.